A facelift or meloplasty is a procedure performed under general anaesthetic. Once you have been anaesthetised and are asleep, a local anaesthetic solution is injected into the facial tissues to decrease bleeding and to reduce pain. The incision is made from within or in front of the hairline, and then in front of the ear, around the bottom of the earlobe, and behind the ear into the hairline. Through this incision, the skin is elevated to a level approximately in line with the pupil. In the neck, the skin is elevated from the deep tissues entirely. It is not tightening of the skin which gives a facelift its lift, but the deep tissues in the form of the SMAS layer. SMAS is an acronym standing for Superficial Musculo-Aponeurotic System. It is a thin fibrous layer which lies beneath the skin and subcutaneous fat and above the muscles and nerve layer. It is contiguous in the neck with the platysma muscle, a thin layer of muscle which invests the neck from the jawline to the clavicle. It is this SMAS layer which is tightened, usually by removing an oblique segment between the cheek prominence and the angle of the jaw. The edges are then reapproximated. In the neck, the platysma is tightened at the sides by elevating its edge and suturing it further posteriorly or backwards. Often this is combined with tightening the muscle at the front of the neck through a separate incision under the chin. Once the deep tissue tightening is complete, the excess skin is removed. Importantly, the skin is not overly tightened. This way, with the tension held by the deep tissues, the skin does not appear overly tight, avoiding the windswept appearance so obvious in an inexpertly performed facelift. Also, with little tension on the incisions, scars tend to settle very well and inconspicuously. They're never completely invisible, however. At the end of the procedure, 2 small drains are placed behind the ears to remove any excess tissue fluid and reduce swelling. A bulky dressing is then applied, which is removed at 48 hours when the drains are also removed. You'll wear a supportive chin strap following this for around 2 weeks. You'll return to see me for suture removal the week after your surgery.